Hi, I'm Dr. Ted Arkfelt, the chiropractic reporter, and I am standing outside the courtroom in the trial of the century. It's finally happened, ladies and gentlemen, and you're not going to want to miss this. If you have been to your primary care physician and they always blame arthritis on everything, they throw up on the box, the views, the MRIs, and they say, well, there it is. It's arthritis. That's what's causing your pain. And I guess you just got to learn to live with it. You're going to want to stay tuned for this explosive trial. What's going on? It is the patients versus arthritis, the trial of the century. So, what's at stake here? What do we have? Who are the players? We have the medical community that is the prosecuting attorney, and they are blaming arthritis for everything when it comes to chronic pain. The defendant, arthritis, and they are going to call some explosive witnesses to the stand to debunk the medical community's allegation that arthritis causes every single problem when it comes to chronic pain. All right. So, okay, I'm just fine getting word right now. Okay. So they have up on the stand right now for the prosecution, they have an X-ray view of a knee that is arthritic, and they're asking the questions and they're really probing, saying, well, isn't it true that you have more pain after walking and doing certain activities? Oh my gracious. This is astonishing, ladies and gentlemen. The prosecution just rested their case. They're basing everything on the diagnostics, the X-ray and the MRI, and they're saying, okay, we don't need to call any further witnesses. Case solved. The defense attorney just stepped up and said, not so fast. What am I hearing here? Oh boy. Oh boy. 3 explosive eyewitnesses, expert witnesses. The defense has just called the central nervous system or the brain. He has called the peripheral nervous system, and he has called the autonomic nervous system. This is unheard of. Absolutely nobody's ever thought of doing this. Okay, so the central nervous system is on the stand right now. And okay, here's I'm gonna paraphrase the testimony of the central nervous system. Central nervous system is saying that the body has receptors in it, and that those receptors are responsible for sending signals back up to the central nervous system or the brain, so the brain knows what's going on with the rest of the body. And if those signals are not making it up to the brain, it will go into protective mode and lower the threshold for pain. So even when it's not a structural or mechanical problem anymore, many times, such as in arthritis and other disc degeneration and all sorts of other things, especially post surgical rehab, when the structure has been taken care of, what's still causing the pain? And the brain says, I am, because I'm not getting signals back up. Nobody's done any kind of rehabilitation to turn those signals back on from the muscles and from the joints, from the tendons, and from the ligaments. You go, so I don't know what's going on down here. I got to protect my neighborhood. I got to protect the anatomical neighborhood, the rest of the body. So I'm the sole causation of pain after a while with chronic pain. Wow. I tell you what, that's eye opening, right? If you've been experiencing chronic pain, did you ever think that it's your brain? Wait a minute, the brain just added one more thing. Make no mistake, he's not saying it's all in your head, that it's imaginary. That's not what he's saying. He's saying it's the brain not getting the information up, very much like a bad cell coverage area, and that's what is causing the chronic pain. All right, so now the peripheral nervous system is going up to testify. Peripheral nervous system is saying, yes, there are certain structures like in the muscles called muscle spindles, and if they're not being stretched, if they're not being activated, they lie dormant and they're not going to get the information up to where it needs to go into the brain. And then the muscles get weak, you quit moving, it hurts to move, and it's a vicious cycle. Makes sense, right? Same with the joints. Joints, if you've had post-surgical repair on a shoulder, hip, knee, and they've done nothing except structural rehabilitation, if they've not done neurological rehab, then it's not going to work because they haven't reset the nervous system. Powerful message. Powerful. Nobody's ever thought of that. So the defense attorney just asked the peripheral nervous system what is a therapy that they would recommend. And without a doubt, they said a direct current neurological therapy, not a TENS unit, not alternating currents like you see in most PT, but a direct current neurological therapy, such as like the Newbie device. For those practitioners that are using that neurological therapy, they're getting unbelievable outcomes. So the defense attorney just nailed down what is the appropriate therapy for this. So he just dismissed the peripheral nervous system. He's bringing the central nervous system back on. He's going to ask him more questions. So he just asked the central nervous system, is that true that a direct current neurological therapy is the best? And the brain just said, absolutely. That's what jump starts and gets the information back up. And that's what helps me understand what's going on. And I get the signals back up so I know what's going on. And then I raise the threshold for pain. Wow. Okay. He just thanked the central nervous system for their testimony. And last but definitely not least is the autonomic nervous system. That is your stress. When you're out in the woods, you come across a bear and your heart rate goes up, your respiratory rate goes up. People live like that. So he's just called the autonomic nervous system up. And he says, is it true that you are in the anatomical neighborhood in the brain, in the limbic system, close to where people feel the pain? And autonomic nervous system just said yes. And he says, is it also true that you will start to interfere with sleep patterns because you will make a patient anxious, maybe even depressed when they are in chronic pain? Autonomic nervous system just said, yes, that's true. So would you agree that the majority of providers out there that are experts in pain management and in chronic pain and post-surgical rehab are not doing anything to address autonomic nervous system dysfunction? Autonomic nervous system just said, yes, that is not being addressed. The defense attorney just asked what he's recommend. Brain tap entrainment. It will allow patients to get out of that fight or flight, allow them to get to sleep. It's an app. You can try it for 15 days free, and then that'll help you get to sleep. There's so many different versions, but it's brain entrainment. It's training the brain waves to get you out of that fight or flight. Wow. Wow. Okay. So he just ended questioning with the autonomic nervous system. The medical prosecutor is starting her closing arguments. Okay, very simple. The medical community is saying we are still relying on the structural aspects of X-ray and MRI that show that there is arthritis as the sole causation for chronic pain. We rest our case. Defense attorney just came up. Well, ladies and gentlemen of the jury, as you can see, there is another explanation of chronic pain that deals with the nervous system, not just structural or mechanical. And that's why those doctors that do neurological rehabilitation achieve excellent results. They get results where others have failed. Okay, he just ended his summation. The judge just let the jury go for deliberations. It's been 5 minutes. The jury just came back in. They had their verdict. In a stunning move, ladies and gentlemen, arthritis is not guilty. Not guilty is what they just said. Arthritis is not guilty as the sole cause of chronic pain. This is unbelievable. This is absolutely unbelievable. All right, if you like this, what I'm going to recommend, subscribe to the Defeating Pain channel, comment, and tell your friend. Until next time, I have a feeling that there's going to be more court cases as a result of this landmark decision, and that we're going to have degenerative disc cases come through, probably have some shoulder, knee, and hip. I'm sure that's what's going to happen. So hey, until next time, this is Dr. Ted Arkveld, your chiropractic reporter for the Defeating Pain channel. Take care.